Growing concern after another COVID-19 surge.
It comes after millions traveled for Labor Day weekend. The U.S. now averaging more than 150,000 COVID cases each day and more than 12,000 new hospitalizations.
We have COVID coverage starting with CBS 46's Haley Mason. And Haley, booster shots, they could be available in just a matter of weeks.
Sean, there's really some mixed thought on the necessity of booster shots for the general public right now. I went ahead and reached out to the State Department of Health and asked them, how are you planning right now to register Georgians if they want to get the booster shot? They tell me they're kind of waiting on the FDA and the CDC to first approve them before making plans on how to register everyday citizens. Nonetheless, we know that people are getting shots. We came to one of these urgent care centers where people are not only getting tested for COVID, they're also getting the vaccine. Grantville City Councilman Jim Sells tells me he wasn't just vaccine hesitant, he was a self-proclaimed anti-vaxxer.
It was all political. I wasn't getting information from the doctors and medical community.
That's until he got sick with COVID-19 last month and was sent to the hospital barely hanging on.
I got sick and then didn't know how to help myself. Like so many in my group, I self-medicated at home with whatever nonsense I'd seen on social media. I got sicker and sicker. I didn't have a clue how COVID killed people when I walked into the hospital and they put me on oxygen.
He says he's now following the science and doctors only and looking forward to being vaccinated. This all as doctors are now trying to roll out booster shots or third doses. The Biden administration wants booster shots from both Pfizer and Moderna rolled out the week of September 20th. But they're now saying Moderna may take a week or two longer to roll out its booster because of paperwork and FDA approval.
We're not going to do anything unless it gets the appropriate FDA regulatory approval and then the recommendation from the advisory committee. Looks like Pfizer has their data in, likely would meet the deadline.
Dr. Anthony Fauci stating this week that 3 doses may soon be the norm for fighting COVID-19. But local public health expert Dr. Harry Hyman says the science around the possible waning vaccine effectiveness is still unclear. He says only the immunocompromised right now need a third dose.
A number of public health experts agree that there will likely come a point when a booster is necessary, but at this point it's unclear when that is.
As for Sells, the first 2 doses will be a welcome change.
I will be for the booster. I don't want to go back to the hospital. I don't want my lungs shut down again.
And again, Hyman saying the general consensus is that people who are immunocompromised are eligible for the booster right now. And those are the people that it's probably most necessary for at this point in time. Reporting live in Buckhead, Haley Mason, CBS 46 News.
Haley, thank you.